Hi, so I'm going to go ahead and explain to you what's inside a Foley Catheter Kit. The first thing I want to point out is that there's always the size of the Foley Catheter Kit right here. So this one we have today is a 12 French. So the purpose of this video is, again, to show what's inside it. I'm going to be breaking the sterile field multiple times. Again, that's not the purpose of the video. The purpose of the video is to demonstrate what you will find in here if you are a new nurse or student nurse. So when you open this, the first thing that you're going to come across, as you see, is I have this drape. Okay, the drape does have a 2-inch border. You want to keep that 2-inch border as you're opening it, and then you're going to slide it around like that so we don't contaminate our sterile field. On the top of your Foley Catheter Kit, you're going to have your sterile gloves. Usually, nurses just set them aside and they'll deal with them later. If you have extra small hands or much larger hands, you're going to need an additional set of sterile gloves that will make the procedure much smoother for you. The next thing you have underneath that is what's called the Fenestrated Drape. And so I'm going to open that up and show you what that is. It actually has this little hole right here. It's very useful if you're inserting a catheter on a male, and when you insert the lidocaine, which you can see one of our other videos for the demonstration of that. But usually for the female, we don't use this fenestrated drape. That's up to you. It depends on how you've learned that. Okay, the next thing you'll find is the waterproof drape. It's important to note that there's going to be there's two sides of this. And so you want to take the shiny side down, which is this side right here that I'm showing you. This is the non-shiny side down. You want to put the shiny side down on the bed, like so, if this were to be the bed, okay? So I'm going to go ahead and throw that in my trash bin over here. And then on top of your kit here, you have a few more items. This particular Foley Catheter Kit comes with iodine sticks. Other Foley Catheters kits comes with cotton balls and then a packet of iodine, which you would open and drop that iodine on the catheter kit as well, those cotton balls. So it depends on which manufacturer you have for that. Next, you have a saline syringe filled with 10 C's of saline, which will be blowing up the balloon once it's inserted into the patient. Then you also have your jelly, okay? So when you're prepping, you want to use these compartments here and insert your lube. And then these, just for demonstration purposes, are going to be your iodine solution. And just the tip is it works best if you actually can remove these sticks and put them there. And the reason being, for example, if you are inserting a Foley catheter on a female, you have your non-dominant hand holding the labia, spreading it open. If you leave the sticks within the package, it's very challenging to get in there with only one hand and take the stick out. So we recommend that you take out your sticks from the package. When you look at what's underneath in the bottom, you have a specimen cup if you need to collect a urine sample. You also have this little clip, which is called a bedside clip, which will keep the Foley catheter tubing attached to the bed, prevent pulling and tugging on the patient. Then you have your catheter system here. It's an enclosed drainage system. This part here is the part that you're going to insert in the patient. It's wrapped in a plastic to prevent it from being sterile, to keep it from being sterile. Then you have your tubing, and then of course you have your bag, okay? One thing I want to show you on the bag is each bag's slightly different, but it has this little slide piece here. One of the positions that it comes with is closed, which is this blue piece is blocking any liquid from going out. If you need to drain that catheter, you're going to push your finger across here, and then now the liquid or urine is able to drain through that into your graduated cylinder. Very important to make sure you close it and to get here that slight click, so the urine will now drain into the bag and not onto the floor. Okay, so when you are at this stage and you want to get your catheter, continue to prep, you want to make sure you're holding this, and you want to be very mindful of this because this tube can be floppy, and you want to make sure you're keeping it sterile. So you want to do this slowly, so you have it like that, and then you can do the lube there if you would like as you're prepping it. couple of the other pieces that's important for us to note are these two ports right here. All right, so you have this port right here, and then this port right here. This port is the port that you will be inserting your saline flush to blow up that balloon. And as an example of what a balloon looks like when it's blown up, you will not do this at the bedside. We do not pre-inflate balloons. We only inflate the balloon once the catheter is inserted in the patient. But just to show you what it looks like for demonstration purposes, this is a inflated balloon, and by inflating this balloon, it will be able to stay in the bladder and will not come back through the urethra. So that's what it looks like. The other port that I wanted to mention is this port right here. This port allows us to get a urine sample if we need to. To do that, we would clamp our tubing for 15 to 20 minutes. We would use an alcohol pad, and we would clean the area and use a needle and a syringe, and then insert it into this port and withdraw the amount of urine that we would use. Some other catheter manufacturers have removed this port, and they have a lure lock type system where you can take your an empty 10 cc syringe, and you actually can just use the lure lock system and screw it on here. This particular catheter manufacturer does not have that, but those other ones are becoming more and more common in the hospital. So I wanted to have you guys be aware of that. The other thing that's important is that you can always know the size. Here, again, we have 12 French. The package showed us 12 French, but if you didn't insert that Foley catheter, you're not gonna have that package. So you're not gonna have the liberty to know exactly what size it is. But you always can tell the size because it's standard on Foley catheters for the sizing to be right there. So you would want to include that in your assessment chart.